Pastoral communities in the Horn of Africa have long sustained critical lack in access to health services for humans and animals, and their environment is prone to massive degradation. Endeavors to address these problems have often been fragmented and limited. In response, Vétérinaires Sans Frontières Suisse, VSF Suisse, in partnership with Comitato Collaborazione Medica, CCM, an international livestock research institute, ILRI, is implementing its One Health for Humans, Environment, Animals, and Livelihoods, One Health for Heal, project to enhance the well-being and resilience of vulnerable communities in pastoralist and agro-pastoralist areas of Ethiopia, Somalia, and Kenya. This short documentary aims to showcase VSF Suisse project implementation practices in Borana and Liban zones of Oromia and Somali regions in Ethiopia for partners and stakeholders to draw key learnings. A novel approach, One Health for Heal integrates multiple interventions addressing human, animal, and environmental health through capacity and system support for existing local government institutions.
One Health approach is basically a demand-driven intervention. It is a community-based intervention. Each service provision institutions were doing everything separately, and there were no integration and coordination between these sectors. So through One Health, we try to bring together these institutions.
At the core of implementing VSF Suisse's projects is the utilization of local government community platforms. At Warada level, task forces have been set up comprising local government experts from health, agriculture, environment, and other key sectors actively engaged in informing One Health planning with VSF Suisse and addressing critical needs identified and reported by local communities.
VSF kunini hojii baay'ee nu waliin hojjetee jira. Hojiilee isaan gammaatti nu waliin hojjetan keessa tokko hojii nyaati beelladaati. Nyaati beelladaa hojii marga gogaa fi furushkaa gandootaan irratti nu raabsanii jirani. Gam biraatiin ammoo qorichaallee wal qabatee qoricha beelladaa nu dhiyeessanii turani. Qorichi nu dhiyeessanillee uummat keenya nu waliin ta'anii mariisisanii uummat mariisan sun akka revolving inni ta'u revolving fund ta'ee achumatti qorichi gatii xiqqaan gurguramee uummatumaaf akkaawuntiin banamee fi achumatti akkaataa isaan itti fayyadamaa jiran waan baay'ee gaariin waliin hojjechaa turani.
At Qabale level, One Health units have been established to provide human, animal, and environmental health services for target communities. Today, a One Health unit from Malbana Warada in Borana is setting out to an outreach site in Chaliliche Qabale to provide One Health services. Facilitating grassroots implementation of One Health for Heal project, One Health units bring together service providers and members of multi-stakeholder innovative platforms, MSIPs. The MSIPs are set up as a community platform, bringing together Qabale administration leadership, health workers, development agents, women, and community elders. Through their regular conversation, MSIP members identify key community issues and bring them to the attention of the local government and VSF Suisse for timely One Health intervention.
Rakkoon nurraab mari'annu laftinu namuma rakkooti waan buna waan fayyaa nama waan fakkeenya fayyaa horii waan rakkoo ganda kan kee jiraati rakkoo karaa dheedumsaa karaati haubaa kabuna waan akkanarra wal mari'anna. Waan ammoo rakkoo nu hin dandeenye qaama dhimmi ilaallatu dabarsin jennee rakkoolee hedduu waan akkana kan wal mari'an.
Pastoralists in both Somali and Oromia regions live far from health facilities, and One Health for Heal project works to reach them through integrated human, animal, and environment outreach health services in 2 qabales in Borana and 7 qabales in Liban zones.
Waan duraan rakkoon armi jirtu kiiloomeetirii 22 mooyyalee jirram. Mootoriin tokko fudhachuuni birri 500 nam geessu mooyyalee jechuudha. Birri 500 darsoo marsii nam geessuu danda'a. VSF'n daawwaa nu dhufteeni asitti muka yaalatti ardhu waliin marroo 5 ejjina kana jira. Qorsisuun arganne nami sila rakkataan ka transportii sun fara baasuu hin dandeenye. Ka rakkoo sun qabu rakkoo sun bahee transportii sun duwwaa daawwaa sun akkasitti argachuu jira rakkataan.
እስከ ዛሬ ድረስ ዋን ሄልዝ ዩኒት የሚባለው እዚህ አልነበረም። አሁን እንደ ፓይለት እየሰራን ነው። በዚህም ከዋና ጤና ፋሲሊቲ ርቀት ላይ የሚገኙት ሪሞት የሆኑ ሰብ ቪሌጆችን ነው ታርጌት ያደረግነው።
One Health for Heal provides these services through government health workers and environment experts who received One Health training to ensure proper project support for communities.
One Health unit የምንላቸው አንድ ላይ ሆነን እንድንሰራ አኒማል ሄልዝ፣ ሁማን ሄልዝ and environmental ሄልዝ ላይ የተለያየ ትሬኒንግ ሰጥቶናል።
በወር 10 ቀን እንሰራለን። በወር 10 ቀን እየሰራን እንሰራው እዚህ መድኃኒት ሁሉም ነገር አለን። አንዳንዴ ደግሞ አሳልፈን ኢፒአይ እንሰራለን። ክትባት እዚያውን እናንተ የምታበብ ቦታ የለም ሄልዝ ፖስት እኛ ራሳችን እንዲመጣን ያጋዝ እየሰራን ነው ከቪኤስኤፎች ጋር።
Like in Somali's Livelihoods zone, the outreach health services have been critically important for pastoralists in remote areas of Borana and Oromia.
Ramotordo kararra targanne biridi shaniti ngadum dibshan bamne agdika hanayu yar maslatan ana argatiyo salagme gayane garbiri qumla ma bam wana khimi fudat male wanin utikidi bam amma asitu yarganne akhimanne fayarganne ilmedenne tungalgalga.
VSF Swiss's integration of animal health services with human ones have been vital for pastoralist communities and project target areas whose livestock are their major asset, enabling them to save money they use to spend on traveling long distances in search of these services. More importantly, they have enabled them to save human and animal lives caused by lack of affordable access.
Karkarsi anar argadde derejiti lona akhimi dasa argad am qorsi sullen qorsidan sa qorsolon gabbisu qorsolon kasu akan nujedu warri am sabab khana fi arm gadumne lona sijirani
outreach gosgosa olin hojjechaan turre marsa sadaffaaf guyyaadha jechuudha. Kanaa waliin guyyaa sadaffaa outreach guyyaa lama saayitii bobbaane saayitii sun irratti immoo waan health unit irratti hojjenne
የሚሰራው በፕሮግራም ነው። ናቹራል ሪሶርስም አለ፣ ቬተርነሪ አለ፣ ሂውማን አለ። ሶስቱ አንድ ላይ ኢንተግሬት አድርገው ነው እየሰሩ ያሉት። ይህንን ከጀመርን በኋላ ብዙ ለውጥ ነው ያገኘነው።
VSF Swiss is also implementing its Viable Innovations for Resilience and Livelihoods viral project in 6 qabales of Miyo and Moyale Waradas in Oromio's Borana zone, through which it is promoting community resilience by supporting grassroots hydroponic fodder production and use.
የእንስሳ መኖ እንዴት እንደሚሰራ ሎካሊ እሱን ነው የምታስተምረው ፕሮጀክቱ። ኦሬዲ 6ቱ ቀበሌ ላይ አክቲቭ ነን ጀምረናል። መጀመሪያ ስልጠና እንዴት መኖ እንደሚሰራው ለህብረተሰቡ ሰተን በየቀበሌው 60 ሰዎች ነው ያሉት። ያቺን 60 ሰዎች ትሬን አድርገን እንዴት እንደሚሰሩትና ሳይተን የጀመሩት ነበሩ።
While development interventions remain the focus of most of the projects led by VSF Swiss, recurrent drought in the target areas has made it critical that the consortium adopts a crisis modifier to provide humanitarian support to affected communities.
Moyale Warada is currently experiencing one of the worst droughts in decades, attributed to failures of 2 consecutive rainy seasons in 2021, as well as infestation of locusts in 2020.
As part of its emergency response, One Health for Heal provided animal feed for 300 households in 4 of its target qabales in Somali's Livelihoods zone. So far, One Health for Heal has reached 239,732 members and 364,340 livestock accessed health services in both Somali and Oromia regional states through its interventions integrating human, animal, and environmental welfare for improved livelihoods of pastoralist communities. The results are generally encouraging with this first phase intervention by VSF Swiss and its partners. Considering the mobility and vulnerability of pastoral and agro-pastoral communities in Ethiopia, the integrated approach to service delivery with multiple sectors collaborating for improved access to One Health services will need to continue to be an important intervention to sustain and scale up.